So it was back in 2002 when I first serendipitously, almost accidentally, went down the path of more of a holistic approach to using nutritional supplements to help my patients at that time. And I had a practice at that time that was filled with bipolar patients, and many of them came to me heavily medicated and not doing well. They were suffering from a lot of side effects from their medications, and I was really looking to add adjunctively to the healing process with their medications so that they would have a much better outcome. And so I heard from one particular patient that she had heard about a supplement called Empower that was supposedly very helpful for bipolar patients. It took me about 3 months to think about it and decide whether I wanted to contact the company. But eventually, in March of 2002, I made a phone call to this company and was assigned to someone at the company who would be there to help guide me through the administration of this supplement. And what this company was doing was they were asking me to give my patients 6 capsules 3 times a day of their nutritional supplement, which is a very, very high dosage of vitamins and minerals and their mix of amino acids that was in that particular supplement. So as I started to use this for my patients, some with depression, some with bipolar disorder, I noticed after a while that there were 2 groups of patients that I could differentiate. The group that would do really well and would initially get better and over time will be able to lower their supplement regimen and be able to then leave my practice and go on with their lives was the group of patients who weren't on any medications. The group of patients who were taking medications would start off the same as the group of patients who weren't on medications. They would start off by doing much better on the supplements. They would feel like their symptoms were starting to resolve and that the medication would seem a little bit too heavy or sedating. And so we would very slowly lower their medications. But with this second group, the patients who were on medications, I observed that quite a few of them ended up, really struggling and having a difficult time during the latter part of their withdrawal phase. Now, at that time, the company and the individual that was working with me, the way they presented the information was that the supplements are there to help with healing mental illness. And the assumption was that once you heal the underlying causes, you should be able to lower the medications and the patient would be able to do well. So there was really no understanding at that time about the specificity of how these medications had an effect on a patient's biochemistry, their neurotransmitter receptors, and other aspects of their biochemistry and molecular functions. And so there was this assumption that I had at the beginning that if a patient is doing much better, that as you lower the medication, just because the underlying problem has been resolved, the patient would be able to do without the medication and be able to move on, just like the group of patients who weren't on medications. But clearly, my empirical experience and observation indicated that this was not the case. And when I met these challenges, not once, twice, 3 times, 4 times, it became very clear to me that the group of patients who were on medications required more examination, that there was something that they were struggling with that required more skill. And so it impelled me and motivated me to look for more answers for this group. And of course now, 22 years later, I look back on those early years and it's very clear to me that the 2 groups were separating themselves out because the second group had the additional burden of medication withdrawal issues. And until I examined each medication, understood how those medications affected receptors, neurotransmitters, coenzymes, vitamins and minerals, just adding vitamins and minerals and amino acids to heal underlying causes to support the body's ability to heal isn't going to be enough, not for the patients who are on medications. So that whole path of helping people get off medications required many, many years of examination. Each medication had to be looked at separately. What do they do? What are the consequences of using this medication? What is its impact on the immune system? If it causes hypersensitivity reactions either to the medication or to the receptors, what can my tools with energy medicine or functional medicine, how can the tools that I was using intervene to help mitigate those changes in the body? And so over time, I was able to work out all of these different questions so that the two groups, the group that aren't on medications and the group that were on medications, can now both consistently improve over time. So that was an important thing for me to learn through those challenges that I encountered and observed. And I'm very grateful that I observed them, but at the very early stages back in 2002, when I was observing those different groups, it was very scary and it was very difficult, and I felt in some ways powerless because I didn't know where to turn to find the answers. Because at that time, no one was really considering medication withdrawal very carefully. There was a sloppiness about thinking about medication withdrawal, that somehow the body will be able to adapt and you can just lower the medications as long as it's done slowly. Now, there's a small group of patients who really can do fine as you lower the medication slowly, but in the majority of the patients who have been on medications for a year or 2 years really need additional support in order to help them through that process. Another challenge that I faced during the period of learning, and I'm still learning, of course, but the exponential curve of learning at the very beginning of my path down holistic psychiatry was the effect of stress during medication withdrawal. Now, as a psychiatrist, we spend a lot of time studying the effects of medications on the patient's mental health. There wasn't a lot of time spent on understanding how stress has an impact on the body and how that can change the whole way the body responds and therefore creates mental illness. And so I carried that kind of bias and that assumption with me almost without question into my holistic practice. And what I learned along the way is that as I'm working with my patients, quite a few of them would do really, really well during the medication withdrawal. But then I observed that as they suddenly added stressors in their life or something happened to them that would stress them, and if it's chronic and unrelenting, that these patients would start to falter and they would have a more difficult time with their medication withdrawal. So I want to share a story about a woman who came in with her fiance, and they were about to get married, and they wanted me to help her get off her antipsychotic medications so that after they get married, they would be able to have children fairly quickly, because both of them were in their 30s and they didn't want to delay having a family for too long. So I was helping this young woman lower her medication, and she was doing very well. She was coming off this medication smoothly, and there wasn't anything that would be of major concern other than the fact that if she were on too much medication at any point during the medication withdrawal phase, she would have negative side effects from her antipsychotic medication. So then at one point, this young woman and her fiance had an argument over their prenup. And the young woman's family got involved, and it became a huge disagreement between this young woman and her fiance. And because money was a really big issue, they had a lot of money, and therefore it was a high priority to them. The wedding got canceled. And it was canceled about a week before the wedding was supposed to occur. And of course, it was extremely embarrassing and mortifying for this couple to have to cancel their wedding a week before the event. But beyond that, they were arguing about the engagement ring, which was worth quite a bit of money. And the woman's family wanted her to keep it. They said, "You have every right to keep this ring." The young man wanted to have it back. And so they were arguing over the ring. Now, on top of that stress, she decided to hop right into her graduate program in psychology and was spending a lot of time writing long papers, staying up late at night, adding the additional stress of a PhD program on top of everything else. And then she informed me that her family left a dog with her to take care of who had cancer. So she was supposed to take care of this dog who was sick and had cancer. So here was a young woman who went from a blissful, I'm about to get married, everything's great, I'm not having a lot of stress, to a woman who just had her marriage canceled, her dog has cancer, she's grieving the imminent death of this dog, she's back into a PhD program, and they're arguing back and forth over this engagement ring. So she had a lot of stress. And at some point, it was very clear to me that she needed to go back on the medication. So I recommended that, perhaps not persuasively enough or adamantly enough, but I did recommend that she go back on a little bit of medication to help her through this period in her life. And she refused. She said, "I'll just make sure I get plenty of rest. I'll, do my meditations." And, well, it wasn't enough. And over time, she did have a psychotic break. She ended up in the hospital. And the family was furious because they felt like she should have done well, given the supplements that she was on. So what I learned from this kind of extreme example was that when a person is stressed, it's almost like a factory that needs a lot more energy. You have to run that factory a little bit harder, a little faster. There's a lot more work going on in that factory. And like any factory that's working harder, instead of 8 hours a day, now it's working 16 hours a day, is that it creates more waste products. And I believe that it's this waste product that needs to be cleared from the body that a lot of times people who have problems with psychosis or depression or bipolar disorder may have some difficulties with being able to handle during stressful times. It requires a certain, perhaps, vitamin or a certain kind of cofactor or minerals in order for that person to be able to catch up with the needs of that body under dire stress. So whether it's this extreme example that I'm giving of this woman who obviously had a lot of stress piled on her plate, or maybe another circumstance which would be milder, like I had a patient who was doing really well on his nutritional supplements. He was able to heal from his psychotic episode, but he went right into college, took a full load of classes without really consulting with me, and he also became kind of sloppy with taking his supplements and wasn't really taking it seriously. And within one semester, he was right back to where he was before. He was not able to function or concentrate, and he was starting to get paranoid again, and he had to go back home. In addition, when he came back home, without that stressor, he was quickly able to bounce back up using the nutritional supplements. He was able to, think more clearly. He was able to function well. But this young man also had a propensity to smoke marijuana. So every time he would sneak a smoke, he would become more paranoid. So these are different stressors that I've learned along the way, whether it's a chemical stressor, whether it's, from work or school, or from events in your life that you can't control. Stress is something that can make medication withdrawal very difficult because the body's reaction to that stress requires a lot of both energetic as well as biochemical support. You can't just throw supplements at someone enough to cover that amount of stress because there's not enough hours in a day for the nutrients to go through in order for that to happen. And so it's very important when I'm working with patients that I explain to them that stress is something that we need to watch for and control as another element during the medication withdrawal. And I learned it through my experiences, sometimes very challenging experiences where I had to learn the hard way, unlike my training as a psychiatrist, that the events and our environment has a huge impact on our biochemistry. It's not just, here, take a medication and everything's going to be fine as long as you take the medication. That's absolutely not true. We need to take care of many aspects of our lives and not just put our trust on one biochemical fix. That includes nutritional supplements. There was another story of a patient that taught me a great deal about nutrition. At that time, I was putting a lot of faith in my nutritional supplements, but really I didn't have as much understanding of foods and the nutrients that foods provide and how they can have a beneficial or adverse impact on medication withdrawal. So there was this wonderful patient. His name was Michael. He was full of enthusiasm for getting off his antipsychotic medication, and he was doing really well with his withdrawal. About halfway through his withdrawal, he decided he was going to do even better by hiring a nutritionist. So he hired someone who was going to really clean up his diet. He went on this vegan diet. It had a lot of greens in it. It sounded great to me. I didn't know too much about the nutritional aspects of his care, but I just kind of, thought his nutritionist would do his thing, and I, as a holistic psychiatrist, would do my thing with the supplements. But gradually, over the coming months, he started to get worse and worse, and I had to just put him back on the medication, and we had to go back on the medication, and the medication had to go back up at a higher dose, and eventually he had to go back on the full dose of medication. There was no way I could help him get off his medication. He was just obviously getting more paranoid, and he was having insomnia and all sorts of problems. So I really didn't understand that, and I felt really sad for Michael because I really liked the guy. He was doing his best, and I had no clue why he would do so well at the beginning and just eventually kind of couldn't get off his medication. A few years later, I contacted Michael because he needed to buy some nutritional supplements that only I could purchase for him. And he shared with me that he felt that what had happened over the course of his withdrawal was that the nutritional part of his withdrawal was creating a lot of detoxification, and that it was creating so much detoxification that the problem with withdrawal was caused by his special diet, which made a lot of sense because I understood by then that detoxification has to be done very carefully, because when you take out the toxins from the body and dump it into your GI system or in your bloodstream, it can cause a lot of anxiety for my patients, or insomnia. It can cause paranoia and all sorts of problems. So I became very careful about how quickly I detox patients, the manner in which I detox patients. And I started to use a thing called foot detox pads. I know it's a little controversial, but these foot detox pads are made of herbal packs that you just put on the soles of your feet at night. The next morning, you take off the herbal packs, wash the soles of your foot off, and you're not detoxing during the day. So it's a very subtle detoxification. The detoxification is generally through the skin and through the lymph system. And with that detoxification, it was gentle enough that it wasn't causing a lot of wild side effects for my patients. But with regard to Michael, what I learned from his difficult withdrawal process was that, number one, nutrients are very important for us to consider what that patient puts into their body, whether it's a vegan diet versus a mixed omnivorous diet. It really does make a lot of difference. I need to take that into account. How much their diet is actually creating detoxification also needs to be observed. And the other thing, of course, I learned is that detoxification has to be done very gently and not intensely during the withdrawal process. Another thing to think about with detoxification is anytime you support the body's detoxification process, you're actually detoxifying the medications as well. So the blood levels or the functional levels of the antipsychotic medication or any medication that you have in your body will be able to come down much faster. And that's something for a holistic psychiatrist to be aware of and be able to use the tools for testing to be able to follow that as well. As I was moving along with my holistic psychiatry work with my patients, I was learning, of course, a lot along the way. And I reached a point in my practice where I realized there was another grouping of patients. And the grouping of patients was one group was the patients that I was helping to come off antidepressants. And the other group were the patients I was trying to help come off antipsychotics. And it was very clear that the antipsychotic medications were much more difficult in terms of success. And it got to a place where after one or two, it doesn't take a lot of patience for me to generalize my experiences, but after a few, challenging cases, I decided maybe I shouldn't help patients get off antipsychotic medications because they're just really too hard. So I was going to just work with patients to help them get off antidepressants because they were consistently getting better. And they were getting better as I would support them by giving them like 5-HTP, for example, to build serotonin for coming off an SSRI like Prozac or Zoloft or Celexa. But with the antipsychotic patients, I was giving them lots of support to help them stay calm, to help them with sleep. And it seemed like it was just like wasting the supplements. It wasn't doing anything really that helpful for these patients. So it was clear that what was going on with the antipsychotic withdrawal was something I had not yet mastered. So I wasn't going to go there anymore because of the challenges with that field. But then came a patient named Robert. And Robert had called 7 different other psychiatrists before he called me. Every one of them had refused to help Robert get off his antipsychotic medication. He was just on a little bit of Abilify, but he was a chronic schizophrenic patient who had chronic, literally decades of auditory hallucinations that were denigrating and critical of him, and he constantly heard these auditory hallucinations. And Robert really wanted to be well, and he wanted to come off his medication. And he begged me, he says, I don't care if you fail, just give me a try. So this was at a point where I was like, I don't think I can do it, Robert. I don't know if I have the skills. But Robert was really intent on just giving it a try. So I said, well, I'll give it my best. So at the time, I knew about energy medicine already, and I knew about functional medicine. And we integrated the two in a very cohesive, integrated way. So it wasn't just mostly supplements. It was a lot of supplements, but also a lot of energy work. And something that Robert did that I didn't ask him to do, but he was doing in between sessions, was that whatever we worked on during the session, he was doing every day in between the sessions. So he was actually accentuating whatever energy work we were doing during the week. And his medication withdrawal was fabulous. He did really well. He came off his medication. And even when his father got sick and there were a lot of stress in his life because he was living with his father at the time, but his father got sick and he was experiencing a lot of stress, and his brother called me and said, I think Robert has stopped taking his medications because he's not doing as well. He's much more irritable and is kind of a little paranoid or something like that. And so I called Robert in right away. And even though his brother didn't know this, Robert had been off his medications, his one medication, Abilify, for over a year by then. And so he had been doing so well that his brother hadn't noticed that he had been off medication. But when his father was sick, he was starting to get his old symptoms back. So what we did was we rechecked his need for supplements, which were much lower at that point than what he had been on before. and we increased a bunch of, supplements, among them niacinamide, which was very helpful, and vitamin C, and he was on some minerals and things like that. And I had Robert come back in a week. And within 1 week, he was already feeling much better. So I know that for patients who are starting to have or show a lot more symptoms, that sometimes if you just support them more with nutritional supplements, they do get better. And Robert did get better, and he needed that additional support as his father was struggling with his strokes. Eventually, his father did die, and Robert weathered that on the supplements. And after he was finished with his grieving process, and we worked through that using energy medicine, Robert's supplements went down. I followed Robert for several years after that, sporadically, just to make sure he was doing okay, checking on, the nutritional supplements, doing some energy work when he would come in to visit. But literally, I have not had a visit from Robert for probably about 10 years now, because he's been doing well, and he hasn't had to come back to see me for any reason whatsoever. So he taught me quite a bit about medication withdrawal. And the most important thing that I did during my work with Robert was one day I decided to use my energy testing to ask a very important question. The question I asked was, given Robert's successful withdrawal from his antipsychotic medication, what percentage of his success was due to energy medicine, and what percentage was actually due to his supplements? And now Robert was on, a lot of supplements, and he was also regularly getting energy medicine. So he was being fully supported from both fields of medicine. And I expected something like 70% from the supplements, and about 30% from the energy medicine. When I did my energy testing to see what his success was due to, like how it was possible for Robert to be so successful when the other antipsychotic medication withdrawal was so difficult, my energy testing gave me back an answer that I had a hard time believing at the time. It said 99% of Robert's success was due to energy medicine, and 1% was due to his supplements. I thought, Robert's on over 20 different supplements. How could it be that only 1% of his success is due to the supplements? Obviously, this energy testing is wrong. But over the years, I've come to understand the reason why antipsychotic medication withdrawal has to rely on energy medicine. And that is because when a medication, such as an antipsychotic, blocks a receptor, and you start to lower that medication, the best way for medication withdrawal to work is if that receptor on the cell membrane is taken off the cell membrane by the body's cell. There is no supplement that can do that specifically, not with the specificity that an antipsychotic medication withdrawal would need, because most of the antipsychotic medications affect over 20 different subclasses of receptors on our cell membranes. It's like a buckshot of a wide variety of receptors are affected. And there's not enough supplements or herbals that is calming enough that can very specifically target these receptors. So with energy medicine, you can actually use energy medicine to decrease the number of receptors on these cell membranes through the route of information and through informing the body the adaptation that is required in order to handle the next step of the withdrawal. I actually did this for patients later on, many years after I worked with Robert, and their medication withdrawal from antipsychotics became just as easy as medication withdrawal from an antidepressant. I also noticed that energy medicine is really critical for other kinds of medication withdrawal that normally would be very difficult if you were just relying on nutritional supplements or functional interventions. They are medications such as benzodiazepines, for example, which are notorious for having horrible withdrawal side effects, and also addictive substances such as cigarettes, marijuana, alcohol. those kind of things. There's a lot of different substances where without energy medicine as an intervention, withdrawal would be much harder just using nutritional supplements. And I'm guessing that they have very similar needs as antipsychotic withdrawal. So my last story that I want to share is a recent patient that I was working with who came to work with me to come off gabapentin, a mood stabilizer, Latuda, it's an antipsychotic, and Vyvanse, which is a stimulant. So she has been, taking these medications for many years, and she wanted me to help her come off these medications. So she came off the gabapentin pretty easily. That was the very first kind of layer for her. And then we started working on the Latuda, and she was coming off of that pretty easily. And then we started working on energy medicine to help her neurotransmitters and to improve everything. And we noticed that she was starting to struggle. She noticed that she was starting to have these very strange symptoms like dizziness, headache, fatigue, nausea, and she didn't know how to improve. And I used all the supplements, and it didn't seem like with the energy testing it has anything to do with Latuda or anything to do with the Latuda withdrawal, because the energy testing was still continuing to lower the Latuda, even though she was having these really strange, what we thought were withdrawal symptoms. And then one day we were having a session, and she said that she had gained some insight as to what was going on with her. Apparently, every time she vaped, she would start to notice that she would get more dizziness, nausea, headaches, and, anxiety. And then her symptoms will start to kind of wane and start to get better. And then she would have cravings for vaping again, and she would vape, and again, her symptoms would come up. Obviously, this is not something that she had before she started to heal. But apparently, as she was starting to get better, the vaping, the nicotine in her vape, was no longer creating this state of balance that she had been enjoying in the past. So instead of creating balance, now her vaping was creating imbalance. So she decided she was going to stop vaping abruptly. Now, this is a lady who had been vaping for over 10 years. She would vape every hour when she's awake, and the amount that she was using was 3 milligrams of nicotine in the dispenser. So it was actually quite a low dose of nicotine. But even though it was a low dose of nicotine, it was creating horrendous side effects for her. The moment she stopped vaping, within 24 hours, she noticed a significant improvement in her health. And in addition, I noticed that with the energy testing that she was able to lower her antipsychotic medication much more easily. She was able to come down on the dose much more quickly. So she asked me, she goes, I wonder, Dr. Lee, if a lot of my mental health symptoms have actually been due to my cigarette smoking all these years. Because she had started smoking when she was a teenager, and by the time she started working with me, she was 33 years old. So she literally had been smoking for over half her life. And now she was wondering, well, maybe my anxiety, all of these different symptoms that had caused me to go on gabapentin and Latuda and Vyvanse are really due to this habit that I've had with smoking. And that's a question that we had, and there's a very plausible underlying cause for her mental health problems, because the nicotine she had put in her body is a xenobiotic. It's an external chemical that the body recognizes as a foreign substance. So if you inject a foreign substance into your body every hour for 15 or more years, the body can develop a hypersensitivity reaction or inflammatory reaction to that substance over time. And when the person starts to rebuild neurotransmitters and start to get more balanced, the additional support in terms of the neurotransmitter support that the vaping was providing for her may have been no longer necessary. So not only are the benefits no longer necessary, but all you get is this inflammatory reaction to an xenobiotic that you're taking into your body every hour. And so it could have really been one of the reasons why she had such poor mental health. So I just wanted to mention that before she stopped vaping, she was so sick that she wasn't sure if she could go to work the following week. She had her own business in photography, and she wasn't sure if she was going to be able to travel and go to that photography job. And then after she stopped vaping, within 24 hours, she felt so much better that she went to that job, did a great job, and was happily scheduling for another photography stint in her business. So this young woman was able to heal quite dramatically within, a couple days from just stopping a toxic substance in her body. And of course, what we did to allow her to be able to stop vaping without horrible cravings is that we used a lot of energy medicine to help her with her body's dependency, and even the psychological dependency of the activity of, just breathing in some kind of vapor into her mouth that had become a habit for her. So we worked on all different aspects of her habit of vaping, not only the biochemical aspects, but the psychological movement and activity of holding something in her hand. We worked on all of them to help her to be able to easily stop vaping and to be able to maintain that. And she has been actually doing very well off the vape and is moving very smoothly now with her antipsychotic withdrawal. This might be kind of an extraordinary example if it hadn't been that I had another patient who, through her healing process, she was supposed to come off a last little bit of antipsychotic medication on a given day. This was something that her body was prepared for through energy medicine. And on that day, instead of stopping, she took her antipsychotic, that little tiny little bit of antipsychotic medication by accident. And she had a horrible reaction to the antipsychotic medication. She said she felt dizzy, she had tachycardia, her heart was racing, she felt fatigued, she had to rest. She didn't know what was happening, but it was, in terms of the timing, it was directly after she took the antipsychotic medication that day. And then when she stopped taking it, the following day, she did very well, and she no longer had any of those types of symptoms occur anymore. So we were both amazed that her body had such a bad reaction to the small amount of antipsychotic medication. Certainly it wasn't due to the biochemical impact of that medication on her neurotransmitters and everything, because it was such a small amount. So I think that what may have happened was that the immune system may have reacted to that little bit of medication, almost like a vaccine would create a kind of a inflammatory reaction, and she may have had almost like an allergic reaction to that medication at that point. So having all of these different examples of challenges during my medication withdrawal and learning from them is really where I gained my expertise at this point, because there was no school or no easy way for me to gather information. It wasn't like I could go to a conference and say, oh, this is what I can do for SSRI withdrawal, or this is what I can do with antipsychotic withdrawal. I mean, all of these things had to be figured out through just study. You have to study the medication. I had to look for, supports that were natural or herbals that could be supportive. And even now, as I encounter different challenges, I'm always trying to learn more. What is it that is making this difficult? And how can I make it easier the next time I encounter this problem with another patient in the future? So as a holistic psychiatrist, I feel like I'm always expanding and always learning, and it always keeps me very humble as I work with patients. So honestly, I feel like whether medication withdrawal is easy or whether it's challenging and difficult, I always learn something from my patients that I can carry with me to help the next patient even more efficiently and even better. And I think if it weren't for these challenges and difficulties that I encountered along the way, I would never have been motivated to look beyond my current level of skill, and I would still be just using one supplement, Empower, just like I did in 2002. I'm really grateful for all of the different challenges I faced during medication withdrawal with my patients because they have really helped me to grow as a holistic psychiatrist, to master antipsychotic and also antidepressant and other medication withdrawals as smoothly and as safely as possible. Well, thanks for listening to my presentation on antipsychotic withdrawal challenges and everything that I've learned through them. I hope that it's been very helpful for you as you consider the intricacies and challenges of any kind of medication withdrawal. Please subscribe to this weekly video for more informative insights on holistic psychiatry. Also, if you haven't done so already, please subscribe to my weekly updates on my website, holisticspsychiatrist.com, for wonderful stories and developments from my holistic practice, and where you'll find links to all my social media platforms. For those who want access to professional grade supplements, you can register for FullScript on my website under the Products tab. FullScript is a wonderful dispensary with lots of excellent brands that you can use, that you can rely on. Once you're registered under my name, you'll be able to see some of the supplements that you regularly use for my patients for their medication withdrawal. Until next time, let's keep building our well-being and have a wonderful, joyful week. I look forward to having you join us next week.